I'm Dr. Joe Esposito, and welcome to our podcast, For the Health of It. Remember to subscribe to our podcasts, and I'll help you naturally get well and stay well.
The information presented on this program is not intended to take the place of your personal physician's advice, and it is not intended to diagnose, treat, cure, or prevent any disease. Discuss this information with your own physician or healthcare provider to determine what is right for you.
Are you suffering needlessly? Dr. Joe can give you advice on how to naturally get well and stay well. Dr. Joe Esposito.
Hey folks, Dr. Joe Esposito here. I am so glad that you're with us today. We're having a wonderful day. Hopefully you are too. What we're going to talk about today, first part of the show, we're going to talk about your digestive system. Because the number one reason we see patients, and I've been doing this a long time, the number one reason we see patients is for pain. Back pain, neck pain, shoulder pain, headaches, numbness, tingling, car accidents. The number two reason that we see patients, by far, is the digestive system. So I can imagine that everyone listening right now can relate to what we're going to talk about today. Every one of you. Sometimes, we might talk about menstrual cramps or something. Well, half the audience can't relate. Everyone is going to have some digestive issue story. Gas, bloating, diarrhea, constipation, acid reflux, cramping. And so we're going to talk about first how the digestive system works, and then we're going to break it down for you as to what to do for each part of the digestive system to get it to work. And then if we have time later on, we're going to do a segment on what's called irritable bowel syndrome. Now, that's a generic term. Crohn's, colitis. We're going to cover a lot of these conditions, what they are. And ironically, regardless of what your diagnosis is, I'll give you a little sneak preview here. Regardless of what your diagnosis is, the treatments are almost all the same. That works real well. So that's kind of cool. So whether you're diagnosed, and sometimes you're misdiagnosed too. It might be irritable bowel syndrome, might be Crohn's, colitis. Celiac is a little different too. But the treatment is almost always the same. And so I'm going to make it real easy for you. So if you have a digestive system, you need to listen to this show. If you don't, you can tune out right now. But if you have one, you want to tune in. So the digestive system, people think about it, you say, it's just my stomach. I eat food, it goes in my stomach, it gets digested, and then it miraculously moves on from there. It's a much longer process than that. So digestion starts, when do you think digestion starts? In your mouth? How about this? It starts in your brain. And a real simple thing I want you to do right now, okay? Imagine this. If you're driving, don't close your eyes. But imagine this for a second. I've got a big, juicy lemon in front of me. Can you picture it? Really big, like the size of an orange. And I'm going to roll it on the counter. I'm going to break up the fibers in the lemon. I'm going to slice it in half, and it's really juicy. Juices are pouring out. Now, this is the tartest lemon you've ever eaten. Everybody picturing and tasting the tartest lemon you've ever eaten? What's happening? You're salivating, aren't you? Everybody is. What happens is digestion starts in your brain. When you think about food, your digestive enzymes start to flow. And the reason you're salivating is saliva, spit as you want to call it, is the beginning of your digestive system. It has something in it called salivary amylase. There's a big word. Salivary amylase breaks down carbohydrates. So that's why it's so important to chew your food. Not only to break it down and make it easier to digest and absorb, but the salivary amylase, the spit, the saliva, is beginning to break down carbohydrates. Little fun fact for you. If you ever bake something, what's usually one ingredient that goes in there that doesn't make sense? Salt, right? Always pinch of salt. Why do we put a pinch of salt in there? Salt will cause you to salivate, and the saliva being released will break down the carbohydrates and make the food taste sweeter. So that's why we add a little salt to our baking. Pretty useless information. But now you understand why the salivary amylase is so important to start that digestive process. So digestion starts in your mouth, saliva goes, breaks it down, lubricates it, and it goes down into your esophagus. That's your throat. And in the esophagus, it's a tube that connects into your stomach. Now, muscles in your esophagus contract and push the food down. And when muscles contract and push food along the way, it's called peristalsis. There's a big fancy word for you. So peristalsis helps the food move along. Your stomach breaks down food using stomach acids. Okay, so there's hydrochloric acid, and somebody sent me this question the other day on my website, and I said, well, hydrochloric acid activates, is part of the digestive process by activating the enzymes. And he came back and said, well, hydrochloric acid isn't an enzyme, it's an acid. I said, you're absolutely right. But hydrochloric acid activates pepsin, which activates pepsinogen, which then makes the food break down. And the stomach's main job is to take proteins and break them into something called amino acids. Now, the way this works is kind of cool. Proteins look like a ball of yarn. And if you take that ball of yarn and unravel it, that's what the digestive enzymes do. And as it unravels, it chops up the proteins into something called amino acids. Now, different amino acids do different things. So as a chiropractor, as a pain management expert, as an orthopedist, I'm big on the nervous system. So I keep going back to the nervous system. So the stomach breaks protein into amino acids. The amino acid tryptophan combines with vitamin B6 and creates a chemical called 5-HTP. 5-HTP now becomes serotonin in your brain. Serotonin is the neurotransmitter that makes you happy. It helps you focus. Serotonin becomes melatonin, which helps you what? Sleep. But it's interesting. I've been talking about this for years. And new research out on melatonin is that it helps prevent or fight COVID. This is new research that we didn't know about. So one of the things I want to make sure you have happening in your body is a healthy digestive system. Because if the stomach is breaking proteins into amino acids and tryptophan creates 5-HTP and 5-HTP becomes serotonin, serotonin becomes melatonin, that can be part of the process that keeps your body healthy. We didn't know this years ago. We know that now. So we're discovering new things with the body every minute of every day. And there's still a lot more to discover. But the bottom line is we want the body to work as best as possible so that you're getting all these benefits that we don't even know about, that we're not going to know about for another 10 years. So if I've got healthy serotonin, melatonin production, I didn't know 5-10 years ago it was helping my immune system fight viruses. Now it is. But how do we go back to getting the body working properly? So if your digestive system isn't working, starting with the stomach, we're not breaking down proteins. Tyrosine becomes dopamine. Dopamine gives you what? Pleasure. We all want pleasure. Pleasure's awesome. But if you're not digesting your food properly, you're not breaking the proteins into amino acids to produce the neurotransmitters to give you pleasure. Now, I've been doing this a long time. I've been in practice 36 years. I've never, in my entire career, and I've seen thousands, I may even venture to say tens of thousands of patients, I've never seen somebody with an emotional disorder, anxiety, depression, bipolar, ADD, ADHD, ever not have a digestive problem. Every one of them 100% of the time. So when they come to our office, they think, well, I'm going to a chiropractor's office, I'm going to get adjusted, I'm going to feel good. And then we talk about their digestive system. And then we talk about nutrition. And their minds are blown. I had no idea that this can all be offered as part of my healthcare plan. Yes, it is. So if you're not breaking down your proteins, you're not producing neurotransmitters. Neurotransmitters are the chemicals that make your brain work. No wonder you're depressed. No wonder you're sad. No wonder you have ADD. No wonder you can't sleep. So by fixing the nervous system from a chiropractic standpoint and fixing the digestive system and getting you on good supplements, now the body is able to start to function normally and the brain essentially can reboot itself. And it's amazing. In fact, just yesterday, I had a patient come in, severely depressed. Nice-looking lady, in great shape, dressed very well, depressed as she can possibly be. 3 of my doctors had to go in and talk with her, myself included, to discuss what we were talking about because she was so depressed she couldn't even focus on what we were telling her. She gets her husband on the phone. Husband's a big fan of mine. He gets on the phone. We start talking. And I explained to him what we're trying to do. He says, well, she can't sleep. And I explained this whole thing to him. And he says, Doc, I've been listening to you for years. Whatever you say, I want my wife to do it. And so I'm real excited when patients like that come to us because people with neck pain, back pain, headaches, my team of doctors are really good at fixing those problems. In most cases, we can't make promises. But I consider my doctors, my opinion, some of the best in the world. And they're my doctors too. I'm their patient. So of course I want the best. But we add then the nutrition, we add the digestion, and we get in there to try to fix the cause and not just treat the symptoms. So digestion is really important, and the stomach is the key to breaking down the proteins. To move along, so I don't take up all day just on the stomach, which I could probably take about 10 hours on the stomach alone, the stomach breaks down the food, and the enzymes break down the proteins, and then it's passed into your small intestine. And in the small intestine, it's very acidic, the stomach contents. When it goes into the small intestine, if that acid was left alone, it would eat a hole in your small intestine. And we call that an ulcer. So why doesn't the stomach acid, which is strong enough to literally burn a hole in a carpet, if you were to dump it on a carpet, not burn a hole in the small intestine? Your pancreas kicks in. Now, most people think pancreas and they think, well, that's diabetes and insulin. Pancreas does a lot more than that. The pancreas releases essentially baking soda. And it squirts baking soda into the small intestine, right where the stomach meets it, and it neutralizes those acids. If the pancreas isn't working properly, you're not neutralizing the stomach acid properly, you've got problems. So now the pancreas dumps that in, and now the mouth started breaking down carbohydrates. The stomach breaks down proteins. We got to start talking about fats now too, the 3 what's called macronutrients. The pancreas releases a chemical called lipase that breaks down the fats. So far, what have we done? We've had one place for carbohydrates, fats, and proteins to be broken down. The body is so darn smart. It has 2 places to break each one of those down. So now here comes your pancreas again, and the pancreas releases other chemicals, lipase and amylase and protease, to break down carbohydrates, fats, and proteins. And it neutralizes the acid. This is why if you get pancreatic cancer, it's so deadly. Because your pancreas is doing so many things. It's breaking down fats, carbohydrates, proteins, neutralizing acid, and what you know about, it also produces insulin to help the body absorb sugars. And so if the pancreas becomes diseased, first thing that happens is it gets bigger. Whenever an organ is damaged, the body is so brilliant it makes it bigger. And so the pancreas is now enlarged so that it can produce more of what it's producing. If it gets overworked, eventually that's when it can fail. And that's why it's so serious. You've got to take care of the pancreas. So if your stomach isn't doing its job breaking down proteins, the pancreas has to step in. If the mouth isn't breaking down carbohydrates, the pancreas has to step in. If your gallbladder, didn't mention that one yet, if the gallbladder isn't producing bile to break down fats, the pancreas has to kick in. So the pancreas is the backup plan for everything. And if you're abusing your body, maybe you've had your gallbladder removed. Now, I'm not saying you shouldn't have your gallbladder removed. I'm saying try to do everything you can to not have your gallbladder removed. There are times I've sent people out for surgery. I send them out for surgery very often. And we have a referral list of doctors that we work with that are some of the best in the world. So I can't fix everything, but they can't fix everything either. And so we work as a team to co-manage our patients. And that's what's kind of cool. So if the pancreas starts to fail, you don't have a backup plan anymore. And the reason it fails is because your mouth, your stomach, or your gallbladder aren't doing their jobs. And so the pancreas has to kick in. So I don't want to get too confusing here, but it's really important that we keep it working properly. And the way we do that is really easy. We stop abusing it. Stop putting food in your body that's so hard to digest, because that puts strain on all these organs. So I call them the 7 deadly sins. These are the 7 foods I suggest you cut back or cut out of your diet. You know what they are, right? If you're a regular listener, same with me. Alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener. Now, if you're a new listener, you said to yourself, but Dr. Joe, alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener is my whole diet. That's all I ever eat is alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener. I can't survive on anything less than that. Yes, you can. I'm guessing there's about 120,000 other foods that you can eat aside from alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener. And when you start switching those foods out, now, here's the thing. You have to eat anyway. You might as well eat good food. Why are you putting these bad foods in your body? One reason. Why would you put bad food in your body? It tastes good. I was normal once. Been about 35 years. But I was normal once. And I used to eat the alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener. And they taste good. I know that. But here's the thing. Once I understood what they were doing to my digestive system and my overall health, I made a decision. And here's a decision I want you to consider. Next time you put any food in your body, I want you to ask yourself this question. Is it worth it? Is it worth it? Is it worth going out and getting drunk? Well, then go out and get drunk. Absolutely. But the more you know about what these things do to your body, the better off you're going to be. And so that's why I strongly advise that you consider every meal that you eat. And I joke, I said, if I would eat it, you can eat it. How about that? But think about every meal you eat. Is this going to be good for me or is this going to be bad for me? And if it's not good for you, don't eat it. Now, as I'm getting older, there's something I do. Whenever I eat a meal that's cooked, now I don't eat animal products. I've been vegan now for 35 years. I'm not asking you to do that. Don't worry about that. But I don't eat animal products. But if I do eat an animal product, I would make sure it's organic. Because 30 years ago, we didn't have to worry about steroids and hormones and chemicals and pesticides and all these other processes that are going on with the food. If it's organic, or don't eat it. Now, I prefer you don't eat it. But here's the thing that I do whenever I eat a cooked meal. So whether it's broccoli or cucumbers or tomatoes or soup, I always take a digestive enzyme. Because the enzymes that we just talked about, how the whole digestive system works, is dropping. The production is dropping as I'm getting older. And so what I try to do is I try to fight the battle and stay younger. Most people think I'm 20 years younger than I am. That's pretty darn good. 20 years younger. That means I'm going to live 20 years more than the average person. I got to start making younger friends. So my friends are going to leave me here. Okay. So I got to start hanging out with younger people because my older friend, a lot of my friends do what I say, but some don't. But here's the thing. I don't not hang out with somebody or not befriend somebody because of that. I just say, I'm going to live this life. And if they want to follow along, great. If they don't, that's okay. I'm still friends with them. But I want you to understand that when you start living this lifestyle, people will follow you. What are you doing? Oh, I'm going to have a salad today for lunch. Really? How come? Well, let me explain it to you. Real quick, you don't have to be annoying. Some people can be annoying when it comes to nutrition. And just say, that's it. Or I'll take a supplement or take an enzyme if I'm going out for food. Like my favorite cuisine is Ethiopian food. And that's all cooked. So I'll be there. I'll pop my enzymes. And, I remember a waitress one day said to my friend Tim and I, so what are you doing? I said, I take an enzyme when I eat cooked food. Oh, really? Because the enzyme is going to help break down the food more efficiently. That's going to keep me younger. I'm going to absorb the nutrition better. There's no downside. It's really cheap, too. How much are enzymes? A couple of pennies? And so if you do something as simple as that, you're going to help your digestive system. Because that's what we're talking about today, your digestive system. Take the stress off your digestive system. My other rule is I try to eat something raw at every meal. Now, when I say raw, broccoli, cucumbers, tomatoes, avocados, salad, supplement-wise, I take raw supplements. The two supplements I recommend, minimum supplements everybody should be taking as far as I'm concerned. Dr. Joe's Super Greens and Dr. Joe's Essential Source. They're two powders. They taste great. Both of them have enzymes in them. And the Essential Source, we actually add more enzymes. And so when you take raw foods or raw supplements like Super Greens and Essential Source, that's giving you the minimum nutrients you need every single day. It's a prebiotics, probiotics, digestive enzymes, complete multivitamin. And the key ingredient in there is the enzymes. So if you're not willing to do anything else, at least take some good quality supplements. And of course, the starting point would be Dr. Joe's Super Greens and Dr. Joe's Essential Source. If you've ever had your gallbladder removed, I suggest you take something called Cholacol. Now, Cholacol is made by a company called Standard Process, and I like them. They have very good products. And Cholacol helps you replace the damage that was done with your gallbladder being removed because you got to help break down those fats. And so that's something we recommend as well. Now, I wish you didn't have your gallbladder removed. Some people have to have it removed. It's diseased. If it's diseased, have it removed. Don't be foolish. We have this incredible medical knowledge in this time in our existence. Utilize that. But then I want you to ask yourself a question. Why did I have to get my gallbladder removed? And having the gallbladder removed doesn't fix the cause. It treats the symptoms. Did you eat too much animal fat? Did you have a bad diet? Did you eat a lot of processed foods? That's usually the cause of gallbladder failure. And if you could fix that, now you could not, maybe you don't have the gallbladder anymore. Okay, we got supplements to help you with that. But what else is that diet doing to my body? A lot of bad things. So that's why I suggest supplements really should be a part of everybody's life. I can't imagine a day going by that I don't take Super Greens and Essential Source. I take digestive enzymes with cooked foods. I take omega-3 fatty acids for brain function. People ask me a lot, how do you remember all this stuff? And I said, well, I got a good brain. I was gifted with a good brain, first of all. I could thank my parents for that. But I also take care of it. Omega-3s for brain function. Omega-3s for inflammation. That's really important. B-complex for the nervous system. Again, I'm a pain management expert. I want to make sure the nervous system is working properly. Probiotics keep my intestines healthy. 80% of my immune system is where? My intestines, yours too. Vitamin D. Unless you're out in the sun between spring, summer, and fall, 20 minutes a day, you probably need to be taking vitamin D. I have Dr. Joe's Vitamin D on the website, drjoe.com, and I take 5 drops a day. Now, all the supplements we're talking about are on the website, drjoe.com. We also have over 1,500 hours of podcasts on the website, audio and video, drjoe.com. And if you want to make an appointment to come see us, we have offices in the Atlanta area, Marietta, Duluth, Stockbridge, and West Cobb. We would love to be your doctors. So if you have a health issue, neck pain, back pain, shoulder pain, numbness, tingling, if you've ever been in a car accident, I was at the studio the other day, one of my coworkers got in a car accident. I said, you need to come see us right away. She said, you're right. And so she's coming to see us. So ever in a car accident, if the car was damaged, you were damaged. 100% of the time in my experience. I've never seen a car damaged where the occupants weren't. So if you want to get well and stay well, that's our goal. You can go to our website, drjoe.com. You can book an appointment right online. You can see the offices, all 4 offices. Click on that, make an appointment right online. You can call us. We were charging $375 for the first visit. That was an exam, x-rays, consultation, your first chiropractic adjustment, going over the x-rays on the follow-up visit, and a complete nutrition evaluation. We've reduced that. We're going to stop that as soon as COVID is over. We've reduced that first visit to $199. So you get an exam, x-rays, consultation, first adjustment, going over your x-rays, and a complete nutrition evaluation for $199. So if you want to do that, you want to do it soon. We do accept people with all insurances. Most insurances cover our treatment. If not, we try to match your benefits. So we do accept insurance. We accept Medicare. One of the few doctors in the world left that still takes Medicare. And we have a medical division. So we have a nurse, a medical doctor, and a physician's assistant, and we can do trigger point injections. We could do PRP, which is regenerative cells from your own body put right back into your body to stimulate new growth. We can do pain management, hormone testing. We can test adrenal. We can do hair analysis for heavy metal toxicity. So whatever your health issue is, if you go to our website, drjoe.com, you'll see a drop-down tab, and you can pick the services that you want. They're all there, but make an appointment right now, and don't waste time. The reason I say that is my doctors fill up very quickly, and it kills me when I hear my staff answer the phone and say, I'm sorry, Dr. Irwin is booked that day, because you need the care, but he's booked up. So we have 6 doctors. We have 4 offices. Make the appointment as quickly as you can. That's my recommendation to you so that you can get the best care that I feel is available for your specific issues. So again, the website, drjoe.com. So we're talking today about the digestive system. Food went from the stomach into the small intestine, the pancreas kicked in, the gallbladder kicked in. If the food isn't being broken down properly, it can go into your small intestine where essentially it rots. And when it rots, it gives off gases. So all of us have gas every day. The average person passes gas about 10, 13 times a day. It was funny. I was on Dr. Oz about a year or two ago. And Dr. Oz, we had lots of time together, just he and I. We sat and talked for about a half hour, 45 minutes. The video's on my website, drjoe.com. And we started talking about the digestive system and gas. And he says, I was on the Oprah show, and I'm thinking, I've been on the show now for 2 hours. He says, I wonder if Oprah passed any gas in that time. And we start laughing, and we're having a good time. But gas is normal. That's okay. Excessive gas is the problem. So if you're excessive gas, terrible odors, these are signs that something isn't right. And that can sit in your gut and expand in your gut. So a lot of people have this bloating going on, and all we have to do is straighten out the digestive system, the stomach flattens out. They think it's the coolest thing in the world. I got a flat stomach without sit-ups. No, you got a flat stomach because you weren't poisoning yourself anymore. And so if no other reason, if you want to get a flat stomach, fix the digestive system. Now, I'm not saying don't work out, of course, but if you fix the digestive system, so many health problems go away. The gut is really the key to getting your body healthy. So if you have health issues, always consider the digestive system first. My office, we want to get the nervous system working, digestive system working, and good nutrition. If we can get those 3 things happening, nervous system, digestive system, and nutrition, most people are thrilled with the results. And the biggest complaint I get, by far, why didn't I do this sooner? Why did I wait so long to do something as simple as take a digestive enzyme? Take Dr. Joe's Super Greens, an essential source. Take vitamin D to reduce my risk of COVID by 50%. Studies out for vitamin D. So, folks, if you have any questions, if you want to make an appointment, go to my website, drjoe.com. Make your appointments right now. Make sure you follow us on social media at Dr. Joe Esposito, Facebook, Instagram, and YouTube. Folks, I'm Dr. Joe Esposito. Again, the website, drjoe.com. Tell your friends about the show. Thanks for listening to For the Health of It. Remember to subscribe to this podcast, and I'll help you naturally get well and stay well. You can also listen to and call into my radio show live Sunday evenings from 7 to 9 Eastern Time on WSBradio.com and on a WSB Radio app.